If you follow the development of the sector here in Zambia, you see that public health is being pushed out to all the districts, to all the constituencies. So as much as HIV/AIDS, TB and malaria programs are growing, they have to have the assurance that there will be an institution for the logistics and supply chain that will make those programs happen. Medical Stores is a state-owned company with a mandate to handle the procurement, warehousing and distribution of all the medicines and medical supplies for the whole public sector in Zambia. I think over the last 4 years, we've seen quite some dramatic changes. In Zambia, we have a very good working relationship with partners, and the Global Fund is one. The partners came to the aid of the government. So there was a lot of support to create the systems, the processes, and also to build the human resource capacity that is needed to run this organization.
So what you're seeing here, this is the inbound section of the main warehouse. In other words, we call it the receiving department. We book the suppliers, both international and local, and then we deliver. And what you're seeing is our guys, they are offloading one of the antiretroviral drugs that are supposed to be used next year. The guys are palletizing, sorting it out, and then we shrink wrap them. After this, when we do the internal processes, then we've got to put them right what you're seeing here into the racks.
I'll take you through the steps from the time we receive orders from the facilities up to the time we dispatch orders. The system is computerized. From the time these orders come in Medical Stores, they are put on the system, which is the warehouse management system. So we isolate the orders that are due for processing. The document that is going to be generated from there is the pick list. Now when it goes into the shop floor, it will be given to the pickers. These are the people who go into the warehouse and then assemble products for the facilities. So once that has been done, the next person who will come is a packer, and if the packer is satisfied with all the quantities and everything, the packer now seals the carton boxes and put a sticker which is showing the name of the facility, where it is going.
Our fleet has drastically increased, and that has been helpful in terms of distribution, because the time I joined Medical Stores, I think 5 years ago, we had about 8 to 9 trucks, but then we are currently operating more than 15. So that has really been helpful because we are able to deliver on time. To be an ART coordinator first is to love your job, to love what I do, and personally Rhoda loves what she does. Partners, when they procure this antiretroviral, they'll be delivered directly at MSL. And MSL will be involved in the distribution and storage of this antiretroviral.
Some of the decisions that were done here was to even set up a whole section of the warehouse that's just for ARVs to ensure that everything that has been procured is safely received and distributed.
In a day, we're able to pick not less than 40 picks, meaning not less than 40 facilities. We're able to pick and make sure we load and pack for those individual facilities.
I think what is really motivating about this is seeing that even from our general staff, when they pick medicines that you've seen in the warehouse, pack them, there is this sense that, this is not just a day job.
That's the most cardinal point, is the facility and the end user, the patient at the facility. So when we are receiving here, we've got that in mind. I think that's the most important mandate that we have here.
For Medical Stores, we still see that we've got a very important role to play. Our service is about saving lives. It's not simply setting up a perfect logistics company. It's really about getting those positive health outcomes.